Do you often find yourself urgently seeking a restroom? This detailed guide explores 10 comprehensive strategies to effectively manage an overactive bladder, offering insights and practical tips for those seeking relief from this challenging condition. An overactive bladder is more than a simple inconvenience. It's a condition that can disrupt daily life and cause significant distress. Understanding and managing an overactive bladder involves a combination of lifestyle adjustments, dietary changes, and medical interventions. Here, we delve deeper into each strategy to provide a thorough understanding of how to control an overactive bladder. Gaining a deep understanding of overactive bladder is the first step towards effective management. An overactive bladder is characterized by a sudden, intense urge to urinate, frequent urination, and in some cases, incontinence. These symptoms occur when the bladder muscles contract involuntarily, even when the bladder isn't full. Factors like neurological disorders, urinary tract infections, and certain medications can exacerbate these symptoms. By recognizing what triggers your symptoms, you can better avoid or manage these situations. Bladder training is a core strategy for managing an overactive bladder. This technique involves extending the time between bathroom visits to train the bladder to hold urine longer. Start by determining your baseline, how often you go to the bathroom. Then, gradually increase this interval by 15 minutes. The goal is to extend the time to 3 to 4 hours between bathroom visits. Patience and persistence are key, as it can take several weeks to see improvement. Before we continue, please consider subscribing and don't forget to hit the thumbs up button. Pelvic floor exercises, or Kegels, are crucial for strengthening the muscles that support bladder control. To perform these exercises, identify the muscles used to stop urination midstream. Once located, contract these muscles for 3 seconds, then relax for 3 seconds, repeating this process 10 to 15 times per session. Aim for at least 3 sessions per day. Consistency in performing these exercises can lead to noticeable improvements in bladder control over time. Diet plays a significant role in managing an overactive bladder. Certain foods and beverages can irritate the bladder, increasing the frequency and urgency of urination. Caffeine, alcohol, spicy foods, citrus fruits, and artificial sweeteners are common irritants. Conversely, increasing water intake can dilute urine, reducing irritation. However, it's important to balance fluid intake to avoid excessive urination. A dietitian can provide personalized advice based on individual dietary needs and preferences. Excess body weight can exacerbate overactive bladder symptoms by increasing pressure on the bladder. Engaging in regular physical activity and adopting a balanced diet can aid in weight loss, which in turn can reduce the severity of overactive bladder symptoms. Activities like walking, swimming, and cycling are excellent options that are generally easy on the joints and can be adjusted to fitness levels. Proper fluid management is essential for those with overactive bladder. While it's important to stay hydrated, too much fluid can worsen symptoms. Aim to distribute fluid intake evenly throughout the day and reduce intake in the hours before bedtime to minimize nighttime urination. Monitoring the color of your urine can be a good indicator of hydration. Aim for pale yellow. A variety of medications are available to treat overactive bladder. Anticholinergics work by blocking the signals that cause involuntary bladder contractions. Beta-3 adrenergic agonists relax the bladder muscle, increasing its capacity. It's important to discuss the benefits and potential side effects of these medications with a healthcare provider, as they can vary based on individual health profiles. Biofeedback is a technique that helps patients gain awareness and control of their bodily functions. For an overactive bladder, sensors are used to monitor the bladder and pelvic floor muscles. This information is fed back to the patient in real time, allowing them to learn how to control these muscles more effectively. Biofeedback is often used in conjunction with pelvic floor exercises to enhance their effectiveness. Constipation can increase the symptoms of an overactive bladder by exerting additional pressure on the bladder. To prevent constipation, include high-fiber foods in your diet, such as fruits, vegetables, and whole grains. Staying hydrated and engaging in regular physical activity also promotes healthy bowel movements, indirectly aiding in bladder control. Stress and anxiety can worsen overactive bladder symptoms. Techniques such as deep breathing, mindfulness meditation, and yoga can help manage stress levels. Regular practice of these techniques can have a calming effect on the bladder, reducing the frequency of urges and incontinence. Controlling an overactive bladder is a multifaceted challenge that requires a combination of lifestyle changes, dietary adjustments, and possibly medical intervention. By understanding your condition and implementing these strategies, you can significantly improve your bladder control and quality of life.
Thank you for watching, and please click the like button and subscribe.